Welcome back to another edition of Youth United. We're working for a better future. I'm your host, Maya Palazzo Martinez, and today we are joined by Wilma Alvarez-Little. She's from the Center of Elimination of Minority Health Disparities. She has a distinguished career in public health, and her work in the area has been prompted so much that even the White House has invited her to announce the health policy she's helped change in the area for culturally and linguistically appropriate health care. So thank you for coming back on this program.
Oh, well, thank you for having me.
So just to brief up on what exactly is the Center of Elimination for Minority Health Disparities?
Oh, okay. The Center for the Elimination of Minority Health Disparities, we're a collaborative effort focusing on minority health disparities in the smaller cities and towns of New York State. So when people think New York State, they normally think the 5 boroughs as opposed to the rest of New York State. So we're looking at smaller cities such as Albany, Amsterdam, Schenectady, focusing in the Capital District. We do our work by building capacity with faculty, including various community partners and health organizations at the state and county level. And then we work with the community to plan, implement, and test strategies to see how we can alleviate some of the disparities.
I see, it's a great center. And so we're actually going to jump right back into it where we left off. And we spoke briefly about obesity and diabetes in our last program, but there are a lot of other serious health problems that are also linked to this. For example, obesity has been linked as one of the causes for high blood pressure, type 2 diabetes, high cholesterol, heart disease, cardiac arrest, strokes, cancers. And there's been reports of children as young as 7 years old having been prescribed cholesterol-lowering medication. 7. I mean, you figure, that's a little too young to be put on anything. So these medicines are normally associated with adulthood, so we have a serious problem. So you want to talk to us about how asthma, hypertension, joint disease are problems for those who are overweight?
Oh, absolutely. These are, for anyone, these are going to be problems. But then when you have issues of comorbidity, it even makes it even more complex, right? So you're talking about asthma, hypertension, joint disease. Let's talk about those 3. We're not even talking about the vision problems. We're not talking about nerve pain. So the 3 that we mentioned can go ahead and bring on their own host of medications that somebody might have to take on a daily basis. So that's one other complex piece. And then the cost involved, and then the management of the care, right? So some folks might think, well, I can handle that, or, I'm going to get diabetes anyway, or I'm going to be obese because that's my family's history. But you know what? That's all in that individual's ability to be able to make changes, as small as they are, to benefit their health. So these are going to be problems or challenges as well, because that could be somebody who might have to take time off from work because they are not feeling well. Maybe the joint pain is too much, that they are not ambulatory or be able to move as much as they would like. Managing that care and the doctor appointments can also be a challenge. Where are they supposed to be where? How often are they going to be needing to take their medications and then fill their prescriptions? It becomes so much more complex. And that's not even talking about the physical implications of how are you going to be feeling 100% and doing your best when you're under the weather. So it has so many different impacts. And this, say, for example, if you're the primary caretaker of somebody else, how are you able to take care of someone else if you're not able to also take care of your health as well? Sometimes what happens is that individual puts his or her health on the back burner because they're worried about others that they're responsible for.
Right.
So this all becomes quite the challenge.
Absolutely, yeah. And again, with all these obesity ties in with food, dieting, that's sort of like the basis, I guess. So we spoke briefly actually last time on food, nutrition, and obesity, but besides eating low-fat and low-sugar foods and more fruits and vegetables, there's a problem with a lot of foods that a lot of people actually don't think about, or it's not really brought up to the attention of people, and that's chemical additives. For example, we have cows injected with all these hormones to make them produce more milk and gain weight, and we have turkeys given steroids and hormones so they lay more eggs, and all these chemicals that are being introduced to the food supply, to the chickens and the turkeys, are actually being introduced into our food supply to make it more profitable to the farmers. So should we be concerned about these chemicals being digested into our diets and not knowing how it's going to affect our body? Because just because it affects, a cow a certain way doesn't mean it's going to affect us a certain way. Obviously, we are more complex than a cow. So,
or the chicken and the turkey.
Oh, yeah.
Well, I think whenever there's something that you're going to be ingesting, it's always wise to, one, know exactly what's in it, and then to approach with caution and make that decision. So for example, even some of our very processed foods, usually the rule of thumb is if you can't pronounce it when you read the ingredients, do you really want to eat it? And so that's one thing to think about.
But do people read the ingredients on the food?
And exactly, are our youth being educated on how to read that box, how to read the ingredients on things, to have the question of, do I really want to eat this food that is so incredibly processed? I mean, I will admit that I can enjoy a bag of chips just as well as anybody else, and the candy bar, which probably has a few more preservatives there than really needs to be there. But are these going to be informed decisions, or are they going to be something that I'm going to be thinking, well, this is what I can afford and this is what I'm going to eat? But say, for example, if I look at, going back to vegetables and fruits, are they going to be something that might be a little bit healthier for you, whether or not they're organic? There's always precautions. The great thing is that in the U.S., there is the FDA, the Food and Drug Administration, that does have some oversight, and it's there.
Think about it, right.
And it's there. I mean, nothing's going to be 100%. But that, I think, adds to the myth then of living in the States that what's here is better, right, as opposed to making sure that whatever you're looking at, you're going to go ahead and be as informed as you can be. Now, say, for example, about the meats and the eggs and chemicals involved, that's one I would say personally to approach with caution. Right. To make sure you approach with caution. And then also, too, making the judgment of, is that really what I want to ingest if I don't know exactly what's going on? That I would say,
again, bringing time back to that financial aspect. Yeah. How is somebody who, can't really afford to even live off a food stamp, how are they going to worry about if their chicken's organic or if it's not organic? They just want, the chicken.
Yeah, they want some type of
they want food on their plate,
and
at least enough to fill them up,
And then now, and that, I think that also brings up a really good point about being the careful shopper, because now, if you go like to the Price Chopper, I can't speak about the Hannaford or the ShopRite, but at least if you go to the Price Chopper and you look at the different types of eggs that are put there, there are, you can go ahead and make the decision regarding on the price range and the nutrition level, which one would be the best for your situation. And then figuring out, okay, this has this does not have that. Which one can I go ahead and afford? So there are options, but just making sure to take the time to be able to look and see what, right, what is the best match.
Again, I think usually affordability comes in before nutrition. They're going to think, I'm not going to spend, $5 on this gallon of milk that's got fortified with omega-3 when I could just buy this generic brand that's $1.50,
Right.
And I'm just throwing out numbers out there, but, again.
Yeah. And then looking at which one, because the Price Chopper brand versus, I forget what it's called, Gaelic or something like that. When you go ahead and you compare the labels, but then, this is where you have to really be the proactive shopper. When you're going and comparing the labels, are they going to be really the same and comparable? And one is going to be more cost effective, and you're basically paying for the label in one situation over the other. So just being aware of what's in it and making that informed choice.
Right, yeah. Again, young people need to be, immersed in this at a young age. I don't really see people, in schools, kids saying, okay, well, which chip should I get? This one has 10 grams of fat, this one has 5. No, they pick flavor, they pick brand, things like that. They pick what they're being marketed to. And they're not being marketed to how to watch out for all these fortified oils.
Exactly.
If you ask half these kids for example, what's phenylketonuria, which is like a false sugar or something in gum, they'll be like, what's that? I don't know, They need to know.
They're not reading it.
They're not reading it. They don't even know what they're eating. So that's a danger too.
And that brings up another point another area that we do with through the center. What we've done is we've worked closely with the K through 12 community in Albany, right, and primarily with middle through high school, because our preschool and elementary cognitively, they're a little young for this, but right, we start asking them questions so that they can make the decisions, and so changes that they can make and how they can become empowered, because our youth have a lot of power. Our society just doesn't guide them in a way to access, for them to acknowledge that power, right? And so that's one of the things we ask them. So how come, this is not happening, or why is this happening, and what can you do that's within your power to do that? So regarding the education piece, are our kids being educated and empowered on how to look at a label, how to, what questions to ask as far as their health and the menus and their selection and their choices. So that's a lot of work that needs to be done, and that's some of the conversations that we've had with our middle through high school kids, so that they have an awareness of what they can and cannot accept.
But then again, think about it. There's some of these kids have horrible eating habits to begin with.
Oh, absolutely.
So you have to really pressure them to break out of these habits.
And we don't want to pressure them, because this is just human nature. The more you tell somebody no, the more they're going to push back and say, you know what, I can and I'm gonna. Right? So how do you present it in a way that it's going to resonate with them and they feel that they have control about it? And then also too, where are the, I don't want to say bad, but where are the not best eating habits coming from? So is it environmental?
Financial struggle?
Is it financial? Is it because
parents?
That's what it is? So I know it's complex.
Absolutely.
It's really complex.
And again, you have to slowly break them out of these habits again. You can't just say, okay, stop eating those chips. You have to start slowly limiting portion size until finally you don't find an interest for that anymore.
Yeah, because adults, you tell them, that's called dieting, right? Stop eating that.
And for a kid, it's like, why should I diet? I'm a kid. That's sort of the first thing. You don't really hear all these kids talking to their friends like, hey, I'm on this diet to lose this amount of weight. No,
nobody's going to admit.
Absolutely not. No.
I know some women who will not admit they're on a diet.
No, then they just seem health conscious. When they sit there and they see everyone around them eating. Think about it, wherever you are too. If everybody's there, eating bad foods, you're tempted to eat along with them. Have a little bit, and then you start serving yourself.
Yeah, exactly, and that's why I had said, earlier that our kids are smart. You can show them better than you can tell them. And our kids are very resourceful, and they get it. They will get it. But again,
there's always that stubborn person, though.
Always. Yeah. Well, yeah.
You're gonna have to find a way how to market to all those kids.
Yeah, right? That's true.
So again, bad eating habits lead to actually weight gain, and for example, we're actually turning the point to girls, because I know the buildup of a man and the buildup of a woman is very different. So weight gain in girls has been identified as a trigger actually for menstrual cycles to begin, and that once that begins, the entire body of a woman changes and how they function. So today, girls as young as 8 has been documented as starting their periods because of overweight and obese. So that's not normal. When you really think about it, that's not really what's supposed to happen. So how do you think parents understand this link and the impact to the children?
Well, I reached out to 2 of our researchers regarding this question, because it is very complex. And one of our researchers said, it's true, obesity is disproportionately experienced by children living in poverty or low-income families, but a lot of the times parents don't see that link. Okay, right. Because probably it's been their history. So sometimes when you're so close to something, it's normal to you, So, and if they do see it, it's not on the top of their list. Oh, obesity. They're thinking that they have so many other priorities. Like, well, at least my child is being fed. But then again, as we're talking, what exactly are they being fed, right? That's the question, right?
They're looking, I think, at the short-term picture.
Exactly.
They're not looking at the long-term. Okay, we're feeding our kid, but what are we feeding our child that's going to have them health benefits down the road? That's why they're getting put on cholesterol medication. That's
exactly. So they're looking at the short-term as opposed to the long-term, right? So that's another piece. And then I asked one of our other researchers, and he said that certainly overweight girls might develop a sign typical of the onset of puberty, but the first sign that's changed is the breast development, and this can be mistaken when the girl has it's like tissue that's being deposited in the breast area. So that is being interpreted as breast development as opposed to tissue deposit.
Right.
Okay, so then now we're getting really, really biological, and so it's easy to be confused. And then there's other things that can contribute to the onset of puberty, so stress in kids. Okay, so for example, studies that have indicated the absence of the father or the father figure in the home causes a lot of stress, and then stress, then develops.
Same thing, other way around.
Exactly, right. So there's, a lot of fat puberty link that's really tricky. And so some folks think that the onset of puberty is equal to sexual maturation, completely different to different areas. So this is really a much more complex question than some folks realize, because now you're talking development that would be happening, you know, in any type of situation for a female who is progressing, and as one of the other researchers said, okay, that's one piece, but are other factors such as environmental and stress also being taken into consideration? But there's
so many factors that could be taken into consideration.
Exactly, but it's happening, but the development and the menstrual cycles are happening.
I think you have to bring across to the parents, in the early stages of the child's life, be a little more cautious, make their food, what they're eating, a little more priority, especially if you have a girl who's going to have all these things coming ahead of them.
Especially if this, since the studies support that the daughter's BMI, body mass index, is reflective of the father's. So if that's going to be, and if there is already an issue with the father, then all the more reason to be a bit more vigilant about the daughter's nutritional intake.
Right, think about it, genetics, you don't choose your genetics. This could be happening on for generations of the family, starting with, the grandfather, and now, 3 generations later, the grandson is having problems struggling with weight. So they definitely need to be aware of what they're doing and what they're eating. So all the problems we've been discussing have this really heavy cost to society when you look at it sort of like in a big picture. Increased healthcare costs, early onset of disease, missing school, work days, and so many others that you could list. So what do you think the government has done? Do you think, well, let me rephrase that. Do you think that the government has done enough to combat this epidemic of obesity?
I think that there has been so much information, at least at the research level, regarding an initiative regarding childhood obesity. There's been a lot of initiative, a lot of encouragement at the research community level to look at areas and work with communities that are being impacted by this. We had talked earlier about what our schools doing, are our kids being active enough? One of the ways that be supportive of this is, for example, like one of the initiatives that I had mentioned earlier with the YMCA, looking at safe spaces, physical activity, things like that. I think too, though, that there has to be reciprocity. Is if there's things being done at the federal and state level, what is being done at the community level as well, and how are our youth being engaged to participate in some of these functions and some of the activities, right? Because some people, some folks, even adults, they hear the word exercise and it's like kryptonite. They want to run in the opposite direction.
Right.
But what can be done to help partner? For example, one of the libraries that I'm aware of, they offer free Pilates classes. And so that's right in the community, that resonates with the community, and nobody has to, walk or hop on a bus or, go extra steps.
But think about it, there's a lot of personal, choice that comes into that. Do people like Pilates? Some people might not like that. That might not be their type of exercise.
Or they might not be physically able to do it.
On top of that, like yoga, I know a lot of people have struggled with yoga. And again, you can't really they can't be so reliant on school districts taking care of children's health concerns when they have to focus on academic. That's practically, I mean, that's what school is, your academics first, then other things come and tied in between. We talked earlier about how physical education classes, again, very ineffective, extremely ineffective with their timing, and how, again, a parent can't be reliant on physical education from school being the primary, exercise for the child, because again, 30 kids a class, for example, one teacher, competition. It's not a way to stay healthy, and it's not even every day. Think about that, right? How many days a week does a student have school?
For how many minutes and all that?
Right. Yeah, you have to take that all into account. So again, sort of flying back into the government area, do you think the government healthcare sector has done enough, invested the needed resources, and helped combat the obesity epidemic in solely minority communities? So now we're kind of shortening the picture down.
I think that's a That's a pretty broad question.
Yeah.
Again, a lot of, say for example, they don't have to be federal grants, because there's a difference, there's a difference between federal grants and foundation grants, and their foundation grants are usually the non-federal. And there's been a lot of outreach, let's say, to encourage communities to apply for funds and organizations within the communities to apply for funds so that they can go ahead and help benefit the community. The challenge, I think, sometimes is how do you get that information out to the community groups so that they know, hey, did you know there's money out there to be able to do this, that, and the other?
Right.
So I think, it's with community groups that have so much going on, and they're usually trying to service so many people in so many different ways, and they do a great job with the limited resources. It becomes sometimes a little overwhelming to try to do one more thing. Not to say they haven't. We've worked with some community groups that have just been amazing at getting stuff done and benefiting the community. Is it going to be, something where the community says, oh yeah, that sounds great, I'll do it? It really depends on the presentation, and that's why how we do research is really important, because we make sure that we engage people in the community to make sure that their voice is at the table, so that they can say, you know what, this is a great research project, this is going to work really well. Or with the research project that we're doing in Amsterdam, we have one of the community people there say, this is really great because they had nothing like this when I was a young mom. So it really depends on that partnership and the information that gets there. The tricky thing is, how do you get the information to the people who really, really want to participate and want to do something?
You need to promote it to them, because they're not going to know about these research projects happening,
Exactly.
So, promotion, especially in the communities where it's needed the most. Come in, have volunteers, for example, come in, promote, talk to the people, community events, things like that. And for our final question, at the center, I know there are more projects being developed to address obesity in minority communities. So what are other future projects that are in idea or in mind or being developed now?
Oh, wow. Well, that's a whole interesting question, because we're thinking about different things that are going on. So for example, we've worked really hard to work with the communities so that the first thing they don't think of is like, oh my gosh, here come these researchers, and once the money's gone, they're gone, because that's a very honest way of thinking, right? And so what we're going to be doing is we're going to be reaching out to more community groups. We're going to be broadening our scope in the Capital District region so that we engage more folks. There's been a distinction between not only the African American community, but the African, the Caribbean community, and the Black community. So we need to look at the other needs. So for example, the Guyanese community in Schenectady, that was a community that we hadn't originally planned on working on, but now is involved. So there's a lot of interesting and exciting things, focusing again on the cultural and linguistic pieces. And culture isn't just race, ethnicity, and language, but
so diverse.
Demographics, everything else. So we're going to be looking at different communities and looking at what we can do to be able to make sure that they have a voice when it comes to some of these issues, just like this, involving obesity, nutrition, disparities.
Financial, and also many things that could tie into that. And so that was actually a really great way to leave the people on a note, because unfortunately we were out of time. But this has been a really interesting conversation. And once again, thank you so much for joining us. It's an honor to have you here.
Well, it was wonderful being here. Thank you.
Yeah, and so thank you for watching to our viewers. And join us next time on Youth United, where we'll be working to continue to discuss important issues and influential people in our communities. I'm your host, Maya Palazzo Martinez, and tune in next time. Why? Because it's about you. Take care.
already knew that I was going to go to college, from a young age. I definitely want to major in political science. After that, I'm going to get my law degree. Then I'm going to come back to Detroit, boost the economy, become the mayor or something, try to make the situation better for other people. I feel like I owe it to the city. I'm determined. It's going to happen. My name is Justin, and I am your dividend.